Okay, hello everyone. I'm Dr. Nancy Stanley, physical therapist, life and health coach. I got a little bit of different setup going on here today because I wanted to show you how to treat your own back pain. And you think, well, why are you doing this? Because I have bumped into 2 or 3 or 4 people lately, that actually about 4, that are having back pain. And now the back pain I'm talking about is a low back pain, an ache. It could radiate to your hip or down your leg. It usually is coming from a disc that's bulging in between the vertebra that's pressing on the nerve. That we can call that lumbago, we can call that low back pain. But I want to show you how to decompress your back, take some pressure off. So many people are sitting and bending over, and literally all we do all day long, first thing we do, we sit on the toilet, or we bend over to brush our teeth, or we reach in the refrigerator. All of those things are putting some undue pressure on our back. So what I'm going to show you is how to undo some of that pressure. All right, so I'm going to show you 4 exercises, maybe 5, but 4 simple exercises that you can do that will help you. And I have taught my clients this for 43 years. I have taught people how to do this for so long. So I want you to pay attention. I'll raise this up a little bit just so we'll be where you can see me. Okay. All right, so we're going to start. I'm going to turn sideways. Hey, Michelle. Yeah, watch this. So I'm going to turn sideways and show you. So we're going to start with our feet just a little bit wider than shoulder width apart. Let me move my camera over because I've got a little company. They're letting the dog out. All right, so here we go. All right, so shoulder width apart, your belly is you're pulling your belly button toward your spine, okay? And the first thing you do is you lift your chest, okay? You lift it up toward the ceiling. In other words, you're not bringing it back, you're bringing it up. It's like you're lifting your spine, so you're elongating your spine. You're not bending or moving, you're just going straight up. So it's like if your vertebrae were sitting on top of each other, you're separating them, and you're reaching the top of your head toward the ceiling. All right, while you're doing that, your feet are a little wider than shoulder width apart. You're gonna lift as you go back, okay? All right, so you don't sink into your hips, you stay in an upright position. So you're gonna go back. I don't know why I turned the camera sideways. I should have had it up and down. And then you're gonna keep lifting as you go up. So you're gonna wanna do that 5 or 6 or 7 times every hour if you're suffering with pain in your back, especially if you're sitting on your job. But you're gonna lift up and you're gonna go back. Okay, and then you're gonna lift again and come back up. So you're gonna lift up and go back, and you're gonna keep lifting as you come up. So that's number 1. All right, I'm about to show you number 2. Okay, so here I have just an old extension cord, okay? You can use an extension cord, you can use a belt, you can use whatever. But I'm gonna put this cord at the place of my pain. So if it's L5, S1, L3, L4, L4, L5, you wanna try to put it there, all right? And here's what you're gonna do. You're gonna lift this cord as you pull into your back. Now, I'm not pulling forward, I'm pulling up like a slingshot. So I'm like grabbing that vertebra with this cord, and I'm lifting up as I go forward. So if bending forward is painful for you, you could do this exercise to try to decompress it. So you're gonna grab it here, you're gonna lift up as you go forward, and you just go to the point of pain. All right, so if that's where my pain starts, then I keep lifting as I come back up. All right, so I'm gonna lift as I go forward, and then I'm gonna lift as I come back up. Now, if that's really painful, don't do that one, all right? If it's really painful for you to do this one. All right, so you're gonna lift as you go up. Same as that first exercise we did. You're gonna lift as you bend back, but now remember, you don't sink into your hips. You lift as you go back. Now I'm pulling on this cord, and as I come back up, I'm still lifting, okay? All right, does that make sense? Okay, you can replay this video to hit the replay and start over again. All right, so now I'm gonna get down on the floor to see if you can see me. Let me back up just a little bit. Let me turn my camera down just a little bit. Hey, Tracy, thank you for joining me. There we go. All right, that should be good. All right. So what we're doing here is we're decompressing the spine with the lift, and then we're bending backward to kind of push that vertebra back into place and do a decompression. All right, so here we go. All right, you're gonna get down on your tummy. All right, and this is the third exercise. We're gonna call this the third exercise. Okay, so you're gonna put your hands in close to your side, just about at the axilla, okay, or the armpit. All right, and you're gonna push up with keeping your pelvis on the floor. So you're gonna push up, and you're gonna extend your arms, and then you're gonna go back down. So you could do 10 of those, or you could do 5, or you could do 7, whatever you have time for, okay? All right, then that's number 3 exercise. So number 4 exercise, you're gonna push up, and then when you push up, you're gonna breathe in. And then you're gonna breathe out while you let your belly go toward the floor. So let me demonstrate it again. Here we go. I'm gonna go. And you're gonna feel the arch exaggerated in your back when you do that blowout, but you're gonna keep your elbows extended. All right, so I'm gonna do that 2 more times. So here I'm gonna go. I'm gonna breathe in, and then I'm gonna drop my belly toward the floor as I breathe out. Okay, so there you go. That's your little tutorial on back pain. The other thing I really encourage you to do is when you're sitting, you want to have your back, you want to have something supporting it in your back. You don't want to sit like on the couch where your back is arched back. You want to maintain that lordotic curve in there. So I just want to encourage you to do that. So y'all have a great night, and we'll talk soon. Oh, if this helped you, if you have back pain and you think this helped, then hit the love button before you leave, okay? Because that's what I'm on here for, is to help you.